probably sat there with like this most stunned look on my face ever, because it was honestly the farthest thing that I'd even thought of. Trust me, I had had plenty of thoughts of what it could be. I didn't expect him to say endometriosis. He said, now, it has been known it can attach to your diaphragm, it can attach to your lungs. Unfortunately, because as you probably know, we have no way to know without going in and seeing it. I would like to welcome you guys back to a peek inside my endometriosis journey. If you guys will recall, I kind of I'm going to pick up kind of where I left off previously. I thought today was a good day because, well, we'll get to that. I had my first laparoscopy on August 31st of 2016 this year. It was a long road to getting to that surgery. If you guys followed along on my previous vlog, you can catch up on that story and how I got to that point. So just to give you a quick recap of what I had done back in August, as my cat buries itself or unburies herself from the covers. During my laparoscopy, we ended up doing a tubal ligation. We did a uterine ablation. We removed my Mirena IUD, and we removed endometriosis lesions that were seen within my pelvic cavity. It was probably about, I want to say about 3 to 4 weeks post-op. I started to notice as I was slowly recovering from the actual surgery. You guys again will recall those previous vlogs that I did. Post-op, about 3 weeks, maybe 3.5 afterwards, I started noticing that I had like this shortness of breath. Kind of felt a little tightening. It was hard to take a deep breath. And it quickly got to the point to where it was on my right side, right underneath my right breast, kind of like the lower piece of my rib cage there. It was extremely tender to the touch, to the point to where like I could not even put any amount of pressure, and it was extremely painful. I couldn't expand my lung to take a deep breath. Was getting a little fatigued. Again, I was still kind of post-op, and so I was slowly but surely, there she is. I was slowly but surely coming out of the actual surgery pain and all of that. So I was starting to recognize these other symptoms. Of course, me fearing the worst, I called my primary care doctor first, kind of gave him a heads up, asking him what to do. He immediately had me come in. I also gave my GYN who had done my surgery, I gave that nurse a call as well. And she was just like, you know, keep me updated, let me know if there's anything we can do, if it's a post-op complication, this and that. So I went into my primary doctor, did a workup. We went ahead and we did a chest x-ray in the office, and then they ran like a lab panel to test for my D-dimer level. And the D-dimer will point out or give indication if there happens to be a PE or a pleural effusion. Basically what it is, it can either be an air pocket or an air bubble that just kind of gets trapped within your lungs, and it can be a complication from post-op surgery. especially from abdominal surgery where they fill your abdomen with the gas and you're under the anesthesia and so on and so forth. So we did that. I went home feeling extremely uncomfortable. The pain was just getting unbearable and it was getting extremely hard for me to breathe. They told me they would call me with the results. And so the next night or next day I went to work and I got a call at like 8:30 in the morning, like right after the doctor's office opened, from the nurse telling me that the lab panels came back and my D-dimer was slightly elevated, which could be an indication of the PE being present in my lungs. So they immediately told me to, they ordered a CT angiogram, which is kind of a very fancy term for saying it's an expensive CT with contrast, but a really good scan, really great scan. So we called, I set that up. I was able to get in that very same day, thankfully. Working within a hospital system, sometimes you can call in a favor, and I was able to call in a favor and get worked into the schedule same day. So I did. Went ahead and left work to go get that done. And afterwards, after having the CT, I went home. I was again very fatigued, very short of breath still. It was very acute at that stage. It kind of immediately billowed up. And it got so bad that I actually ended up going into the emergency room, which, if anybody knows me, again, I work for a health system, so we don't go to the ER unless we're dying. I honestly was scared to death that if I went to sleep, I was going to end up dying in my sleep, because a PE can travel that little bubble of air, even if it's a tiny little bubble of air. You know, if it gets trapped into any of your blood vessels, if it goes through your heart, it can cause a stroke. If it happens to get through your heart and continue on up to your brain, it can actually cause a stroke, an aneurysm, all kinds of complications. So it's a very tricky little beast, that PE. And so, yeah, so I was having the acute pain, scared to go to sleep, ended up going to the ER. They did a complete and utter workup on me. We ended up doing a full blood panel, went ahead and did another chest x-ray. By this time, the CT angio results were up, and so they were able to see the images, or at least the initial report from that. And the initial report that the radiologist read stated that there was no evidence of a PE, but they could see secretions in my lungs and things like this. So at the time I was treated for chest wall pain, right? Not chest pain like cardio, but chest wall pain. And the way that the doctor in the ER kind of described it to me, she said, sometimes there's ligaments in between your ribs. You may have actually pulled a ligament. We can't really see that on an x-ray or the CT. That could be the cause for your actual acute pain. But here's some pain meds, and go on home and rest, this and that. Follow up with your doctor. And so, of course, I did. Followed up with my doctor. I think it was the day after I was able to get into the doctor. Went in to see him. He was suspecting pleural-C, which, another fun medical term, basically shortness of breath, acute chest wall pain, that can be caused in the way that he was thinking that maybe one of those gas bubbles from my actual surgery got trapped between my lung and my diaphragm. Hence the reason it was so tender to the touch. And I was having the shortness of breath. And I had a little bit of congestion. Nothing major. Nothing I would even consider like a cold, but apparently I had a little bit of mucus or what have you. So he put me on a high dose of steroids for 2 weeks. Started off on a very high dose and then tapered down for the 2 weeks, hoping that would kind of pull the inflammation away, allow me some relief, get my ability to breathe back. So I did that round for 2 weeks. At the end of the 2 weeks, the acute pain, so the pain from like actually touching the area, went away. However, the pain started to then spread across my rib cage. And it wasn't that, ooh, I push down and I can feel pain. It was like an internal, almost like a muscular type of pain. That's like the best way I can describe it. A cough, but I wasn't producing anything. I wasn't sick. Again, we ran another lab panel. I wasn't sick. I didn't have the flu. I didn't have a sinus infection. Nothing was coming up in the lab reports. So my doctor was a little stumped. He went ahead and put me on a round of antibiotics just to be on the safe side. So I went back home again. Antibiotics. It was still extremely hard for me to breathe, to the point to where I couldn't even like walk around my house. I would walk from like the kitchen and into the bedroom and be out of breath. Just our washer dryer is actually downstairs, and so just even going downstairs to put the laundry in, I was like huffing and puffing, just trying to catch my breath as I would go down the stairs. It was absolutely ridiculous. So again, I call my doctor back. I let him know that things are not resolving themselves. So they call me in again. My primary care doctor happened to be out of the office, so I saw one of the other doctors in the practice. And he went ahead and looked at my last chest x-ray and also took a look at that CT angio. And he was pointing out some spots that he was seeing that he told me were atelectasis, which basically, when he was starting to describe it, was it's your lungs are filled with capillaries. That's what gets the oxygen to the blood in your lungs and allows you to breathe. Those capillaries were not up to par. They weren't functioning at 100%. Hence the reason I couldn't quite get that deep breath. Now, atelectasis is, I don't want to say common, but it can be common after surgery. However, with antibiotics, anti-inflammatories, it usually will kind of resolve itself after about 2 weeks. So at this point, I am now into October, late October by this point. And still having this horrible shortness of breath, the pain, and everything that kind of went along with it, including, if you can, I don't know if you can tell or not, I certainly can, but this hoarseness in my voice. I'm not sick. I don't have a sore throat. I'm not coughing. I'm not hacking. It's like, what the heck is going on now? So the doctor then puts me on just an albuterol inhaler to kind of help with the shortness of breath. He was hoping that would kind of help my lungs and my capillaries restore themselves. Instructed me to go to the pharmacy and pick up a spirometer, that little thing that you breathe into and it has the ball. Practice my breathing. He gave me some lidocaine patches to kind of put on for the pain. He didn't put me on steroids again. Thank goodness. Did not put me back on steroids, because that was an awful experience. I won't even share it with you. You don't want to know. The steroids can have horrible side effects. I definitely had all of them. So here I was, not having any clue what was really wrong. Very frustrated, very confused, a little nervous. Still not quite sure what was going on, and of course, all I can do is just sit there and think, what is wrong with me? So I went back and forth to my doctor throughout November, on and off, because again, the shortness of breath was not resolving itself. The pain was now getting so intense. Again, it was across my entire rib cage. There were points to where it would get so bad that it literally felt like there was a vice around my ribs, just crushing it. Horrible. I was getting again, the fatigue was awful. I wasn't able to even lay flat still. I'm not able to lay flat because when I lay flat on my back, it feels like there's a brick on my chest. So my doctor at this point has kind of explored all options. He's like, Jackie, I wish I could figure out what was wrong with you. I cannot. I need you to go see a pulmonologist. So he suggested one of the pulmonologists within our health system. He has been there for years. He is like the pulmonologist for our health system. And so I, of course, set up an appointment with him. Unfortunately, when you're going to one of the specialized doctors, you really can't get in on a very urgent basis. So here I was, beginning of November, calling for this appointment, and I finally got an appointment on the 13th of December. I guess that's the best I can do, right? Really nothing else to be done at this point. So I'm just kind of playing it day by day at this point. The shortness of breath is there. The hoarseness in my voice is there. And the pain kind of waxes and wanes. It will come and go. Yeah, just awful, 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 awful. I was starting to get depressed. Because I couldn't do normal things, and I was to the point to where I was depressed, because I felt that I'd been fighting to finally have my laparoscopy done that gave me the relief from that pain, but I just felt like I had exchanged one issue for another, and I was starting to think, maybe surgery wasn't such a great idea. And, of course, all you can do is just lay there and think when you're in pain. And so that's where I was. Mentally exhausted, physically exhausted, trying to keep up with work and the house and the kids and the upcoming Christmas holiday and just, yeah. So I went in, I had a pulmonary function test on the 9th of December. They had that done before my appointment, so that way the pulmonologist on the 13th would be able to see the results of my pulmonary function test. I went into that pulmonary function test thinking that I would go in, I would maybe blow into a spirometer or something. Oh, no. Full-blown anxiety took over that day when I suddenly realized that this was like a real breathing test, okay? I went into this small little glass or plexiglass, whatever, encased booth. The door would shut. You have this one little breathing tube that's hooked up to this big, like, air canister. Looks like a big helium canister. I'm sure it wasn't. I don't really know what all it was. But I would have to blow into it, exhale, as much as I could out of my lungs, take deep breaths in, the whole 9 yards. For me, it wasn't pleasant. I mean, I got through it. I survived, obviously, but yeah, I had a little bit of anxiety about it. And of course, you never know. I didn't know. I was sitting there like, did I pass? Did I fail? Am I breathing okay? I don't know. I don't know what to think. Because of course, they're not giving me anything or any, indication of what's going on. Okay, I'm sure I'll find out on the 13th. So I go in for my appointment on the 13th, meet my pulmonologist, who I've been waiting to see for a month. I'm so glad that I waited to see him, though. For those of us who go through journeys like this, maybe with chronic pain or a chronic illness, such as endometriosis, or anything related to it or anything far past it, you get to that point where you're having such constant pain that you tend to downplay your symptoms because you start to think, oh my gosh, I am sounding like a raging lunatic right now with all of these symptoms. I don't want them to think that I'm just like this crazy person over here or, because again, all you can do when you're in pain and needing to rest is, at least for me, my mind just goes. This man was amazing. He listened to me. He validated everything that I would talk about, validated my symptoms. He let me talk and he let me vent, and he would ask probing questions. I probably met with him for a good 45 minutes. Nicest man ever. Just a genuinely, honest to goodness, good person. I felt validated. Because at that point I was starting to be like, Am I neurotic? What is wrong with me? Nobody can tell me. Am I truly like this medical oddity that nobody can figure it out? Nobody has any idea what is going on? All I want to do is breathe. So he pulled up my CT angio scans and he goes, "Now, Jackie, has your doctor really like gone over? Have you seen your images?" No, I mean, he had them up at one point and I glanced at the screen, but I haven't like looked at, I don't know what I'm looking at. I am not a pulmonologist. So he pulled up my CT angio and went through it for me. And he pointed out all the atelectasis that I had in my lungs. Literally both of my lungs were just riddled with atelectasis. So this was the scan from October. By this time it's December. And he's pointing all this out and I'm like, oh my goodness. I was thinking it was just in one lung, like my right lung, because that's where the pain was. So in my head, I'm thinking, well, hello, pain, that must be where it is located. It was in both lungs. And it was pretty intense. He then went over my surgical notes from my laparoscopy, and he read the notes from my GYN. He was reading the lesions that were excised and burned or cauterized or what have you, and the extent of it. And he turned around and he goes, "This might be a far off shot." He goes, "But endometriosis can spread to other organs." And I kind of just, it completely caught me off guard because I honestly, honest to goodness, after everything I'd gone through over the past 2 or 3 months, I honestly thought I was going to have COPD. I was going to, I didn't know. And so when he said the word endometriosis, I was like, wait, what? And he goes, yeah, the endometriosis can actually spread up. I probably sat there with like this most stunned look on my face ever, because it was honestly the farthest thing that I'd even thought of. Trust me, I had had plenty of thoughts of what it could be. I didn't expect him to say endometriosis. He said, now, it has been known it can attach to your diaphragm, it can attach to your lungs. Unfortunately, because as you probably know, we have no way to know without going in and seeing it. So with this news, I was overwhelmed. I was scared. He explained to me that, of course, he's not, he goes, I'm not necessarily, he goes, I've only seen a handful of cases like this. He goes, in my line, he goes, I don't see a whole lot of these. But he's very open and honest about it. He said that my best course would probably be to have a discussion with a surgeon, just like a general surgeon. He suggested one that he thought would be good. And he said to go ahead and give my GYN a call also. He goes, some GYNs, this is a more advanced surgery, more advanced diagnosis. And you very well may get to the point to where he may not feel comfortable doing it. So that's why I'd like you to consult with a general surgeon. Okay. And I remember leaving the appointment and almost having it be more bittersweet. Like I said, I was prepared for a COPD or anything, really. But to hear the news that the surgery that I just had 4 months ago didn't resolve what was truly happening to me. I was deflated. I was in shock. I was surprised. I was scared. I had this feeling of overwhelming fear of, oh my gosh, this is way bigger than what I thought it was. So I remember I called my husband on the way home, still processing everything that we had just talked about, or I had just talked about with the doctor. And my husband going, well, call, make the call a surgeon, make the appointment. So I got home, and for the next couple of days, I got on Facebook, and there's one group, especially Nancy's Nook on Facebook, which is a Facebook group. It's more or less a support group of women who have endometriosis, who have all different kinds of endometriosis. And I had one of my friends, she actually tagged me in a post that was talking about thoracic endometriosis. And I started reading the article that was associated with it in the group, talking about how endometriosis can attach, it can attach to any internal organ. The usual suspects are your gallbladder, your liver, your stomach, obviously your uterus, your ovaries. For some women, it can spread to the back, to the kidneys. There are cases of it attaching to the spinal column. And then, of course, into, the thoracic cavity, which is your lungs, your diaphragm. Because the way that the pulmonologist explained it was that, it can attach to, he was under the assumption, and is under the assumption, his conclusion from his consult is that there is endometriosis around my diaphragm, possibly in the lung cavity. Again, having no idea how much is in there unless we go in. And so I found this group of women who started talking about, there are specialists who specialize in endo, these surgeons. The nearest one to me, I'm in Kansas City, Missouri. The nearest one to me is in St. Louis, Missouri. So about a 4.5 hour drive. Not horrible. But the realization was coming over me that I'm now going to have to this journey isn't over for me. This is, and I don't want to say the words, but it's almost like it's just starting. Like I'm just discovering, I'm just learning about this disease and the fact that there truly is no cure for endometriosis. A lot of women may even have it and don't even know, because the symptoms can come up in all different ways. For me, it started with very heavy menstrual bleeding, cramping, very painful periods, clotting, and that's what prompted me to go into my GYN originally. Even then, my OB at the time, they didn't even want to touch it. They wanted nothing to do with me when I started bringing up a laparoscopy for endo. They didn't want to touch it. Told me that was basically crazy, and sent me all around town. All the different specialists. And I've told you guys that story. So it was until I found my GYN now that he would even, go in. And I guess in a way I consider myself lucky that I did find a doctor, that I continued to be my own advocate, that I continued to fight, that I continued to talk about my symptoms, that I continued to voice what was happening to me and my body. A doctor can look at scans all day long. A doctor cannot walk in my shoes and know my pain and know the emotions and the stigma that's attached to all of that. Because it does. It wears you down mentally, emotionally, physically, chemically. The next day, the pulmonary doctor, he called me. He personally called me the next morning. I was at work. He called me on my cell, answered that. And I'm still just, I am so thankful that I waited for him to see him. He told me, he said, Jackie, I stayed up last night reading AMA articles about endometriosis and thoracic endometriosis. And he goes, I've been reading these articles and I'm learning about this disease and I'm looking at your scans. And he described to me how he was now very confident that that is what my diagnosis is. Because he said that when he started slicing down into my CT and he was looking at my diaphragm, he said, you know, your diaphragm is a circle. It's a circle. And he explained how when he was really looking at it and really looking closer at it, he noticed that there were ridges all around my diaphragm. And of course, on the scans, there is no mass there. So, you know, that's not a tumor. It's not a cyst. It's not a fluid-filled anything. And he said, I can tell you right now that's what it is. He goes, I can tell you with confidence that's what it is. He again told me to call the surgeon, call my GYN. He said, you know, they may have to tackle this together. It just kind of depends on who wants to do what and how they feel would be the best course. I thanked him profusely to know that not only did he listen to me during that appointment, but he then went home and he studied about this disease. He read about this disease. He took the time to give me a diagnosis that no one else would take the time to do. I have seen a lot of doctors, and I can tell you that I haven't met another one yet who's gone to those lengths. So here I am, post-op, 4 months, almost 4 months. December 31st will be 4 months post-op. I did call the surgeon. I talked to the nurse on the phone, and in my health system, we have the electronic medical record. The system that we're on is so that any doctor can look into your record and see all of your progress notes and your history and physicals, your scans, all of this, right? It's very seamless. That's what we go for in my health system. And so when I was making the appointment, I told the scheduler. She asked, of course, you know, why do you need to be seen? I kind of explained very briefly, you know, don't want to go into too much detail with the poor scheduler. She said, you know what, let me talk to the nurse first. So she asked if she could put me on hold. I say, of course. I said, now, if you'll go ahead, I said, you can look at my progress notes from the consult with the pulmonologist on the 13th. Dr. Vincent Lim is his name. I said, you can look at Dr. Lim's report and look at those notes. Have her look at those. And so she said, okay, great. Put me on hold. 5-7 minutes later, whatever it was, she came back on the phone. And she said that she sat there while the nurse kind of went over everything. And they basically told me that, unfortunately, this is not something that he will tackle. That when it comes to, apparently during his residency, he did some advanced laparoscopies, but he no longer does those surgeries any longer. So they told me to go ahead and go back to my GYN. That would be my best course. And so I did. Called him up next. Left a message for the nurse, who I absolutely adore her. She was such a blessing after post-op. I think I probably raved about her. I don't know. I'd have to go back and look at those videos, but she was great. So I called, left a pretty long, detailed message, of course. The next day, I got a phone call back from my doctor. Guys, in our day and times, I can tell you right now, I work for a health system. There are not a lot of doctors who call their patients back personally. I just got really lucky with mine. He called me. I said, Jackie, I'm looking at Dr. Lem's report. He goes, I'm looking at your scans, and I could hear in his voice, you know, he's looking at them as he's talking to me on the phone. And he said, Jackie, here's the deal. He goes, I agree with Dr. Lem's consult. He goes, I agree that there is endometriosis attached to your diaphragm. And I said, yeah, he mentioned something about the shape of my diaphragm and the scans. And he said, yeah. He goes, I see it. He goes, I definitely see it. And I agree. He goes, I agree that that's probably around there. The problem is that, he said, with the way that he goes in during the laparoscopically, when he goes in, he goes, I can only go so high. And he said, with the placement and where my diaphragm is, because that's a very tricky area. He goes, there comes a point where there's like a point of no return. He goes, if I get in there and there's lesions, and those lesions are into your lung cavity, he goes, you could come out with more issues than what you're going in with. He goes, you're at risk for pneumothorax. He goes, anything can happen when you're up there in that lung cavity and in that space. And he goes, honestly, he goes, I do not feel comfortable going in there. I can respect that. That's something I can get behind. Don't lie to me. Don't bring me into your office and have me pay a $50 copay for you to tell me that you can't do anything. I respect him even more for being honest with me. And I said, okay, so what do we do? So this is where we are now. Long story short, right? So he wants to try this from a more systematic approach first. He's going to have me go ahead and take some birth control, try and control my estrogen levels, because endometriosis actually feeds off of estrogen in your body. That's what feeds it. That's why it continues to grow. You said I'd like to do that for about 6 months, and I'd like to see if that helps at all. If that helps to increase your breathing, because right now my breathing capacity, the shortness of breath, the atelectasis, let's put it this way, the atelectasis has almost resolved itself finally. Dr. Lim still wasn't sure why it took so long to resolve, but it did. Go figure, I'm a medical oddity. So unfortunately, the hoarseness in my voice is because of my diaphragm. When I have a flare, it's pressing on my diaphragm, which is giving me this lovely hoarse voice. Today is a flare day. the pain is different than what it was before. I'm starting to recognize it more. Now that I know what it is, I can understand it more. I can wrap my head around it more. Before, the pain was all in my pelvic area, my lower abdomen. It was awful, 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 awful. Now, it's that same pain, but it's in my upper abdomen. It constricts my breathing. I get very short of breath, very fatigued. I get emotional. I get hot. I get cold. They talk about the endo tummy. I still have endo tummy, except now it just looks like I'm carrying higher up. So yeah, so we are going to do 6 months of some birth control to try and regulate my estrogen levels, see if that can have any effect on the flares, on the intensity of the flares, the pain that is associated with it. And then at the end of the 6 months, we'll kind of reconvene, and we will probably move forward with a hysterectomy at that point. Because once we go in and remove the uterus and the ovaries, obviously my estrogen will quit producing. It will put me into a medical menopause. Without surgery, after the hysterectomy, there's a chance that with the reduced levels of estrogen that the endometriosis lesions that are there could go away over time. It's anybody's guess. Hysterectomy is not a cure. It doesn't mean that that's going to stop the endometriosis from continuing to grow. So I have some choices to make. I either continue to just manage my symptoms and my pain, or I start reaching out for specialists. I have a full-time job. I have my own home business. I have a husband. I have 3 children. I have a house to run. How do you go all over and travel and meet these surgeons and still be normal? I don't know. I don't know the answer to that. But this is where I am. Like I said, today's a flare day. I do have some pain medication that I'm taking. It does kind of help. I've been sitting here with my trusty heating pad on the couch, my blankets all wrapped up. I get very nauseous, so I can't eat. I don't really feel hungry anyway. It's very painful. Like I said, I get hot and cold flashes. So like I had to turn the heating pad on and leave it off for a while. Then I have to reposition it because the pain kind of will move from like the front to the back. And honestly, now with my pain, it's like literally in the middle of my chest. And the way that I picture it or kind of portrayed as almost like a sword going through me, right? Because that's truly how the pain feels. It feels more in, if that makes any sense at all. Can you really make sense of this disease? I don't know. I don't know. So this journey is going to continue. I will be checking in and doing updates because I feel that not only do I need to advocate for myself, but I need to advocate for others who go through pain or go through this and don't know where to turn. I want to help be a resource to help connect people. I want women to be more aware. I want them to be more of an advocate for themselves and their bodies. Because if I had listened to my original OB, I don't even know where I'd be. She all but called me crazy for thinking or even speaking the word laparoscopy endometriosis. I felt so stupid at that point. I was like, oh my gosh, I'm blowing this out of proportion. I don't want other women to feel that way. I don't. And I feel blessed because I've had my children. I have had 3 beautiful babies. I have lost one child at 3 months. Sorry, 3 months. I had a miscarriage. I ended up with a blighted ovum for that miscarriage. It was in between the middle of my first and my second child, so it was years ago. So I feel blessed because there are other women who are trying to conceive, who are younger than I am, and are just starting this or have it even worse than I do. And they can't have a child, or it's very hard for them to have a child. So in those terms, yes, I am blessed. I'm very lucky that I'm going through all this now in my life rather than before. So I'll keep you guys updated as we go and as I progress through this journey, and hoping that I can bring some awareness and help other women to not feel so alone and not feel silly for speaking up when you know something is wrong. That's all I got for now. Thanks, guys.